to talk about the questions that he thinks you should ask before undergoing any cosmetic procedure, something we've been talking about, and Dr. Dayan will join us from time to time to address these issues. Thanks so much for joining us.
Yeah, pleasure to be here.
The reason why we're not pulling this topic out of a bag, this is a hot topic because more than ever before, both men and women are seeking out different procedures to kind of give them a lift or tuck here and there when they want.
Absolutely. Cosmetic surgery is so popular now. It's growing at an astronomical rate, and people are asking questions all the time. Is it right for me? So I put together a list of questions that I think they should ask, which will help them determine if the procedure is right for them and the person treating them is right for them.
Now, you think these questions apply to any procedure? May it be something as simple as a Botox injection or as complicated as a tummy tuck?
Yes, these are all medical procedures, so it's key that you have the right person treating you, and these are questions that will help you get that right person.
All right, well, let's get to your questions. First off, you say, how often do you perform the treatment? That is the question you should ask the doctor.
It's a very important question because sometimes people do things every once in a while, sometimes people do it all the time. You want someone who does the procedure all the time. That's someone who's a specialist in the procedure. You wouldn't go to a steak restaurant and order sushi,
right?
So you want to go to someone who does the procedure.
So if you want a nose job, you need to make sure that doctor does more nose jobs than anything else practically.
Okay. Quite a few, yes.
Quite a few. You say also, ask if you can see before and after pictures, and that's just not to see the work. That's also, you can test the honesty of the doctor.
Absolutely. Pictures get doctored all the time. I think it's nice to ask, can we see before and after pictures? But sometimes you can't trust those pictures 100%. You have to be skeptical.
You have some examples of pictures that have been doctored, if you will, to show better results. The first one here, what happened on this picture?
Well, this lady, it looks like her wrinkles are a lot better, and you'd be really impressed if you saw this. But the truth is, all I did was rub the area for a little bit, and then we took a picture afterwards. And we also changed the lighting a little bit. So just by making a few manipulations, we make the wrinkles look like they went away.
So that woman had nothing done. You just rubbed the wrinkles and put her in the right light, and voila, if I'm a patient, I think, wow, this doctor done great work. She looked better.
Exactly.
Wow, okay.
So you have to be careful. You have to be skeptical of pictures.
All right, let's get to the next question for time purposes. You say, how many treatments are needed? That's what we need to ask the doctor. How many of these treatments will I need? Will I need this Botox every month? Will I need this or that, you know, every other week?
It's a good question, because sometimes you walk into the doctor's office and you think, I want laser hair removal. Right. Is it 1 treatment? Is it 10 treatments? Is it 3 treatments? You got to ask how many treatments it's going to take, because that factors how much it's going to cost and if it fits into your schedule.
Now, I have to say, though, when I went to take a look at whether I could get a tattoo removed, the doctor would not commit to how many treatments. He kind of went, well, between 6 and 11. I'm like, 6 and 11?
Yeah.
Well, for the price, that's a lot of money. I mean, can you give me a number? And he never did.
Well, it's hard because tattoos are very difficult to remove, and we kind of have to play with the laser a little bit until we fit the right settings that works for you. So 6 to 11 is a fair estimate.
Okay. You also want us to ask the doctor, how long has it been used, that particular item? So if it's a new laser or if it's a new product, how long has this been on the market?
Another really good question. Things come and go all the time. You see them on TV, you see them on the radio, you see them in the magazines, you think, I have to have this. But the truth is that these things come and go, and next week they're yesterday's news. Right. So just because it's popular now doesn't mean it's going to be popular next week. Look at Vioxx. Right. It was great, right? Now we're worried about it.
I liken it to when you see a car come out the first year of the car, they're still getting the kinks out. You wait the second or third year, you might get yourself a good one.
Or like a movie. We all get excited when a new movie comes out, and then 6 months later, like, ah, it's terrible.
Okay. All right, well, Dr. Dayan has a list of 15 questions you should ask, and we want you to go to our website, myfoxchicago.com, to get the complete list of things he believes you should ask before having any procedure done. And by the way, Dr. Dayan is going to contribute to our blog, and you're going to soon put up a blog to help many of you who have some questions that we just simply don't have time to answer today. So thank you so much, and look for that on myfoxchicago.com. David, back over to you.